This is Dr. Charles Parker, and you're listening to Core Brain Journal. It's a place where I connect both fresh discoveries and interesting different perspectives from advanced mind science with the realities of real people and everyday life down on Main Street. Well, welcome, gang. Here we are again at Core Brain Journal, and this is episode 048. We're only 48 episodes down the road, but we've been having a fantastic time talking to some really delightful, deep people who get the picture of what we're trying to communicate at Core Brain. It's not what we're trying to communicate. We're trying to facilitate what others are communicating. And today we've got a fantastic guest, Dr. Daniel Twogood. And Dr. Twogood, welcome aboard, Daniel.
Hey, thanks for having me on. I appreciate it.
Started to get into the intro real quickly. Daniel and I had a little conversation before we got started, so I jumped right into it. But he is, Dr. Dan Twogood began practicing in 1983 at the International Sports Medicine Institute in West Los Angeles. Now, when you say is that West Hollywood or is it Westwood? Where is it?
It's close to Westwood. It's close to Culver City. It's where the 405 and the 10 meet. It's the west side of Los Angeles before you get into the beach towns like Santa Monica and Venice Beach and those. I
got you. My son lives in Topanga and works at Cedars-Sinai, so I know a little bit of it. We get out there once in a while. So anyway, so back to it. He treated athletes in the 1984 Olympics. That is totally interesting. I'd love to spend time talking with you about that. In 1985, he opened a private practice in Apple Valley, California, where he lives with his wife and office manager, Willie. He discovered the diet-pain connection, which is what we're going to talk about today, for himself in 1985 and wrote his first book, which I now have to read. I didn't know about it until we really got in this conversation, No Milk, in 1992. And those of you who've been listening know I have a whole thing with milk, and we'll talk more about it. So he's written 2 books since then, How to Rid Your Body of Pain, which is really going to be a main topic that we're going to talk about, in 96. MSG is Everywhere in 97. And in the last 10 years, he discovered more and more about chronic pain, what causes it, and how to get this, eliminate chronic pain in a reasonable period of time. His newest book, Chronic Pain Gone in 90 Days, will be out. It's out already. It was I started to read the date that you had in the thing, but it's out right now. And actually, Dr. Twogood is supplying 3 books for the 048 drawing here at Core Brain Journal. And we'll get to that before we get out at the end of the day. So, again, this is exciting. So let's talk really about the last book, where you are right now, chronic pain. Honestly, to tell you just a little bit background, Dan, we have so many people that have been talking about traumatic brain injury, post-traumatic stress disorder. We have a lot of individuals who've been dealing with individuals who've been at war, but who just are suffering from the stress of everyday life, and then wind up having painful fibromyalgia, that sort of thing, episodes, and not episodes, but it's chronic pain. It isn't an episode when it's chronic. So let's talk a little bit about how you became interested in that topic. What personal tripwire put you over the edge on that particular topic?
Well, I was taught as a chiropractor, the basis of chiropractic is aligning the spine, removing nerve interference so that the human body can run like it's designed to run. And, being optimistic in chiropractic school, we were taught that, hey, if you get everybody adjusted properly, it's going to cure everything. Well, you go out into practice and you find out that's not true. It helps a lot, but there's people who are failing to heal. And in getting to this point, the definition of chronic pain, whether it's post-traumatic stress, where you fail to mentally heal from traumatic incidences, or chronic pain, fibromyalgia, rheumatoid arthritis, all of these are examples of failure to heal. And everything I do in my work is based on my firm belief that the human body is a really well-built organism and it will heal. So if there's failure to heal, what's going on? So my approach was, adjust the spine, that will cause the body to heal. But in a lot of those cases it didn't heal. I'm thinking, what's going on? So I had a patient come in to see me. He's the one who pushed me over the edge. He came in with a shoulder problem, told me that he used to suffer with chronic back pain and headaches until one day he was cured after 20 years. And I said, how'd you get cured? And he said, well, the doctors wanted to medicate him for cholesterol problems. He didn't want to take the medication, but he got fearful about what would happen if he didn't lower his cholesterol. They couldn't solve his headaches and his fibromyalgia pain, so on his own he decided to change his diet in order to get rid of his cholesterol problem. He did that, and as a side effect, his chronic pain was eliminated. I said, you mean your chronic pain was less? He goes, no, it totally went away. By making simple diet changes, he lowered his cholesterol and he eliminated his pain. And if you think about it, I mean, people think, well, that sounds like hocus pocus, but elevated cholesterol, elevated blood pressure, elevated blood sugar, psychoses, chronic pain are all just reflections of something going on in the human body that's basically chemically based. And so the medical doctors will, of course, change your chemistry. They'll be glad to do that, right? If you're depressed, if you have high blood pressure, if you have chronic pain, they have a plethora of pharmaceuticals that chemically alter the bloodstream so that those conditions are altered. Well, my discovery is very, very simple, and that is that there are certain substances that when you consume them, they also have an effect on the human condition. One of those things they'll do is be pro-inflammatory instead of anti-inflammatory, and that's where chronic pain comes from. So I started messing around with people's diets, not by adding some superfood, but by finding out what substances were contributing to the body's failure to heal. Once we figured out what those specific substances were, different in each and every case, then you make certain changes, which is subtraction, not addition, and you get the body to heal in a reasonable period of time. That period of time is in the title of my book, which is Chronic Pain Gone, 90 days. If you cut yourself or bruise yourself, watch what happens. Within 90 days, usually well before that, your body will heal. If you go beyond 90 days, what you have is failure to heal. You have a chronic condition that's being caused by some pro-inflammatory substance that you're consuming. It could be a medication, could be a food, could be a food additive. So that's the basis of my work.
Dan, that's so interesting. That 90-day concept, that's a line in the sand right there. And what we deal with so often is chronic illness without having a clear marker on what chronic is. And chronic illness takes a chronic cure, if you will. And what you're talking about is just so much of what we see in psychiatric practice, in mind science. I mean, people come in, they're depressed with fibromyalgia. They're depressed with back pain and migraines. They have the arthritis. A lot of the individuals we see in psychiatric practice have comorbid, associated, significant chronic pain problems that are directly related to their brain function, no doubt about it.
Right. What happens in those kind of cases is you get the referral network where you got a doctor for the rheumatoid arthritis, you got a doctor for the digestive upset, you got a psychiatrist, you got all orthopedists, you got all these people involved, like all these things are unrelated. But failure to heal from a traumatic incident, like, for example, Vietnam or war or an accident or a death in the family or a divorce or something. What's going on that there's failure to heal? Whether it's a musculoskeletal problem that I look at or a mental problem, basically what you got to do is unload the body. One of my basic concepts is that I like simple concepts, and that is that all pain and all disease, whether it's cancer, schizophrenia, chronic back pain, migraines, heart disease, whatever, all pain and all disease is caused by one thing, and that one thing is too much stress. Now, stress comes, people say, oh yeah, well, my job, my wife, whatever. But stress comes in three forms. There's physical stress, bending, lifting, twisting, falling. There's mental stress, jobs, relationships, past experiences, war, etc. And then there's the one that everybody misses, and that's chemical stress. What are you doing to your body chemically? For example, a lot of the people who have PTSD, then they have these mental disorders, what do they do to help themselves? They drink, or they use drugs. They chemically treat their problem. And so what's missing, I think, in a lot of the treatment is what chemically are you doing to your body that's preventing you from getting over this traumatic incident? Now, certainly there are radical traumatic incidences that we can't even fathom that are very difficult to get over. But you have to give yourself every chance to heal, and that's by removing the chemical, pro-inflammatory, irritating, neurotoxic substances that are keeping you from being as good as you can be and healing as good as you can do.
I want to put an underline and an exclamation point on that, because what you were saying, you were talking about connecting the dichotomy that exists in so many people's minds, and that is the whole business of, you know, what happened to you psychologically and what is the foundation that's actually corrupting you getting over it. And
right.
There's always a psychological, of course, if somebody has traumatic issues occur, there is a psychological dimension. A person can deal with it from anything from neurofeedback, EMDR. There are just many ways to deal. But one thing I've noticed that's been so absolutely referential to exactly what you're saying is chronic psychiatric conditions. Absolutely. Almost every single one of them. I mean, I really haven't. I say almost just because I'm trying to be straightforward and do the medical coverage. You know, nothing's 100% in medicine. But so many of them have the specific things you're talking about, neurotoxins, and ingesting things that are harming them. Let's talk about that. Let's get right into it.
There are two basic kinds of substances. Again, I like general concepts. There's two basic kinds of substances that contribute to pro-inflammatory conditions that can affect psychoses, musculoskeletal pain, neurological problems, etc. The first kind is an allergen. An allergen is a substance that some people react to and some people don't. For example, you've heard of people being allergic to peanuts. Now, most people can eat peanuts and they have no problem. But the people who are allergic to them, they have to avoid them 100% because they will have a reaction, an anaphylactic reaction, a skin reaction, whatever it is. And so there are lots of allergens that some people react to and some people don't. So allergens are one class of chemical substance. The second one is toxic substances. Toxins are substances that everybody reacts to. The difference is that toxins are dose dependent. For example, alcohol is a toxic substance. It's a neurotoxin. If you take a sip of an alcoholic beverage, you may not notice anything. 2 or 3 drinks, you start to feel the effects. If you drink enough of it, it'll make you pass out or it'll kill you. So toxic substances are dose dependent. So when I look at people, I want to know what substances they're allowing into their bloodstream by either swallowing, inhaling, or absorbing through the skin. 99% of them are through the mouth, just like drugs are, and they get into the bloodstream and they have their effect. So there are certain allergens. Now, to tip my hand, the first book I wrote was called No Milk, because what I discovered accidentally after talking to this patient was that there's a protein in milk and dairy foods called casein, C-A-S-E-I-N, that is the #1 pro-inflammatory substance that is an allergen on the planet. If you take people who suffer with fibromyalgia, for example, as a condition that nobody knows what causes it, or at least doctors, they have ideas, but they don't know. Because what do they never ask a patient? What are you consuming? What are you swallowing? What are you eating? And to me, that's the missing link in medicine. So once you start asking these questions, you can start making the connections between what allergens and what neurotoxins this patient is consuming and which ones are contributing to their failure to heal. So that's what it's all about.
So completely agree with you. You know, that's been, and we were talking a little bit off the record before we started with the whole, I mean, I used to call it the New Jersey trifecta just because I'm from Philadelphia and I knew they had the horse races over in New Jersey. But milk, you know, we all hear about gluten all the time. I really would like to hear more about how you discovered and got onto the whole milk issue, because that's what I see. I mean, and I'm a little bit unconventional because I say, well, they're talking about gluten. I mean, if you drive down the Pacific Coast Highway and all those restaurants from Malibu all the way down to Laguna, they all have gluten-free. Nobody says, nobody on the door, almost nobody, I mean, there's some out there say, don't say casein-free.
Right, and the sad news is, it's trendy, and people go for trends. One of the sad things is I'm glad that people are looking to their diets for changing their health, And so they hear about gluten because it's well publicized right now. So the problem is they'll jump in and they'll say, okay, I'm going to be gluten-free. So they cut out all bread, pasta, cakes, cookies, crackers, all the things that have gluten in them. And some people get better, but most people, they just go, wow, I changed my diet. I'm suffering because I'm not having this gluten, yet I'm still having my headaches, my skin problem, my bipolar, whatever it is. And so their perception of that is that, guess what? I guess my problem has nothing to do with my diet. Whereas instead, they only picked one element. And in my new book, I have everything listed in order. Like if you buy a processed food, it has a list of ingredients. The number one ingredient is the most. The second one is second place, et cetera, on down the list. So my book is titled The Substances That Are Number One, Number Two, Number Three, Most Common Neurotoxins and Neuroallergens That Cause Chronic Problems. Many people only react to number one and number two. Very seldom do you see a person react to only number 6 or 7 and not anything above it. The general rule is if they react to a substance that's further down the list, like aspartame, which is NutraSweet, they probably react to all of the substances above them that are more common. So when you look at gluten, gluten is about number 5 or 6 on my list. And so, like we just said, casein is the most common. That's milk and dairy foods. A lot of people will say, well, I don't drink any milk. But they don't realize that casein is in cheese, yogurt, ice cream, cottage cheese, ranch dressing, blue cheese. It exists in the form of sodium caseinate, which is casein again, and items that are actually called non-dairy, like non-dairy coffee creamers, Cool Whip, different things like that. So casein is number one. The most powerful pro-inflammatory substance on the planet is chocolate. Chocolate is the one that blows everybody's mind. They hear that, especially now, a lot of people are getting organic cocoa. Hey, mine's organic. I said, that's no better than organic tobacco. Tobacco is inherently bad. Chocolate is inherently pro-inflammatory. So, you have to get into the details and understand how this works, because a lot of people say, well, I don't do very much dairy. I only do a little bit of milk on my cereal. How often do you have that? Every day. Every day. This is what I tell people. If you consume a substance that your body reacts to in an inflammatory way, whether it's in your cardiovascular system, musculoskeletal, or your neurological system, if you have a piece of cheese and you have a sensitivity to casein, that will elevate the level of inflammation in your body for 3 or 4 or 5 days up to a week from one exposure. So if you're having cheese twice a week, milk in your cereal once in a while, you could be creating a chronic condition all the time. But again, you have to go through the list and find out which things you're consuming and which things are causing you problems.
Dan, tell me, do you do specific testing? I couldn't agree with you more, and I just love the point that you made, which was so interesting about the list of ingredients and all those above would be likely reactive. That's a very interesting point. Haven't heard that before. But do you do testing in your practice? How do you actually ascertain what you really want to recommend for people?
I do the only accurate testing, which is called provocative testing. There are a lot of people want objective tests. They say, I want to take a blood test and I want to see that empirically I am sensitive to gluten or dairy or chocolate or whatever it is. I want to see it in a blood test. I want to see it on paper in a graph. And I'm not a fan for that because so many of those tests are not repeatable. When I was a kid, they tested me for allergy by doing skin pricks on my back. They did like 40 of them at a time and wait for the ones that got inflamed. But everybody would like an empirical test, but the only accurate test is provocative. And what that means is that you provoke a response. So with my experience, I make the guesses and I say, listen, I think these 2 or 3 things that you're consuming are what's contributing the most to your problems. And so let's eliminate them. And then we watch and see what happens. We expect a response within 7 days, another kind of response within 14 to 21, and another one by 90 days. If we see the normal progression of healing, which we've all witnessed in our lives, then hey, we're in the ballpark, we're doing it. Now, if later you want to say, well, am I sensitive to these substances? You say, well, in a controlled environment, eat one of those things and see what happens. So once you see a reaction 2 or 3 times, then you'll know that that's your sensitivity, no matter what the tests say. Because I have a patient, and many patients who have gone out and had the testing. They come back with all these graphs and it says, guess what? I'm not allergic to milk. And I say, yeah, but didn't you notice that every time you consume milk, you get a migraine? Yeah, that's true. You're allergic to milk. I don't care what that empirical test is. The provocative test says that. And so once your listeners realize that the place to look for failure to heal is in the substances they're consuming, they will become smarter than I can ever be about their own cases. They have to know about parameters too, because a lot of people will say, you know what, I cut out dairy food for 3 days. I was no better. As a matter of fact, I was worse. Yes, that's probably going to happen. If you've known anybody who was a regular coffee drinker and they quit drinking coffee, what happens? They get a migraine, they feel bad because they go through withdrawal. So there are time factors that you have to understand. That's why the best thing to do is read the book. You can download it on the internet for 99 cents. So if you understand the parameters, and the way I wrote this book is, the other books I wrote were real thick. You know, if you want to know how to get rid of a migraine, you don't want to open a book and see a sea of words. If you want to build a koi pond, you don't want to read chapters. You want to see IKEA type instructions, right? Yeah. Take this, don't take that. This is what you'll get. And so that's what my book is written like. It's very schematic and very simple to understand.
Well, Dan, I like the way you did that. Even in your notes here to me as an interviewer, you said, hey, look, here's some basic points that I'm going to cover. Here it is. What causes chronic pain and how you can get rid of it. I like the practicality of your approach. And so I'm taking it that the 99-cent book is not a tome. It's a relatively easy read for a person who's interested in progressing through the strategy of understanding what's going on.
Yeah, well, it's 194 pages. What happens is in the very beginning, I put a lot of space between the words in the beginning. So you read a sentence, you know, you've noticed in politics and in everything, people understand about 8 words. Tell them 8 words and they'll get a concept. You go beyond that to 20 and 30 and all of a sudden it's like, wait a second, this is getting complicated. Mm-hmm. So the book starts off with the simple concepts. Within 5 minutes of reading the book, you know what you have to do. You know the routine. The rest of the book gets denser and denser to explain why this is happening, why you have your problems, what you can expect in the healing process, and what you can expect in the future. So that by the time you finish the book, you understand what you can expect and what you have to do.
See, it seems like it should be a required reading for everybody who's dealing with some of these really pervasive, chronic, traumatic conditions post-war, PTSD, brain injury. I mean, it's just, it's almost like...
Yeah, the same thing with like kids in school who are misbehaving, who now have a plethora of diagnoses, you know, their attention deficit, their ADHD, their all these different problems. What those are reflections of neurotoxicity. You know, it's like your kid is drunk. And so if you take all the kids who are on Ritalin and different drugs like that, all of the mentally ill people, all of the post-traumatic stress people, and you make these dietary changes, you're not going to cure them all. But you know what? You're going to take a huge dent in it. And these people who are wasting their times taking neuroleptics and all these, getting shock treatment and going through a different education system because nobody ever asked them what they ate. You know, if you're a marriage counselor and you got this couple and they're just not getting along and you're 10 sessions into it before you finally ask, do any of you do drugs or alcohol? Yeah, we're both high on meth all the time. Oh my God, let's start over, okay? We can't advise you on how to be nice to each other when you're high. But the same thing, the simple concept is here. Whether you're an attention deficit kid, a post-traumatic young man who might commit suicide like so many do. What is the number? It's some unbelievable number. 32 a day or something like that?
Yeah.
It's unbelievable. Yeah. You know, I think we all have different glitches in our brains. The suicide gene chip is in there, but it has to be triggered, and it's usually triggered by a chemical substance more than it is by a situational thing. As a matter of fact, if you listen to the drug commercials on TV at night, many of the drugs, you listen to the side effects occupy the biggest part of the commercial. But if you listen to them, listen how many drugs say Enbrel, any of those immune suppressor drugs for psoriasis and chronic pain and fibromyalgia. Suicidal tendencies is one of the common side effects. What that points out to me is that the neurological system is powerfully affected by the chemicals you put in your body. and the pharmaceuticals are the most powerful. Not only do they, when they unbalance a system to cure you of something, they certainly can cause something else, and they very often do. So if people could just, if your listeners could just get their heads around the idea that changing the chemistry of the body is the most powerful way to affect the human health, then the second concept is not by adding anything, but by subtracting. So there's a big, giant, simple concept for you.
It's very interesting. I remember the first time, not the first time because I was into it for a while, but I had a girl come in, and honestly, with my traditional psychiatrist hat on, she was sitting across the room, and she had big pimples on her face. She was actually actively hallucinating. Her mom was in a chair, and I just thought she was going to need residential care. She was so completely developmentally arrested in so many ways. She was about 16 or 17 years old. And it was early on in my career of actually doing some testing. I do testing because I haven't taken the position that you have, just because I haven't had a lot of confidence in it. I mean, I came from a traditional background, and if I'm going to be unorthodox in medicine, I'm going to be strong on these things need to be done. I've got to figure out how I can cover myself with whoever it is, the medical board that says, why didn't you test them? What's going on with you? So, but anyway, bottom line is we tested her, and she was psychotic on milk, apropos of what you're talking about. She really, and very shortly after she started getting better, after we measured the milk, found it, took her off, and then she's actually grown up, gotten a job. I mean, I thought she was going to just be a ward of the state, and it was really a dramatic change based exactly on what you're talking about.
People need to hear how the mechanism works, because it sounds like hooey almost. Well, we just simply took her off of milk and she was cured of her psychoses. Well, that's not like a crazy idea. This has been researched for many years. That Dr. Marshall Mandel wrote a book called Dr. Mandel's 5-Day Allergy Relief System, and I put a quote in one of my books about a child psychologist who had a patient who was psychotic, and he found out that milk protein is what set off her psychoses, and he called it cerebral allergy. So if you consume the two things we talked about, either an allergen or a toxin, its main effect can be in the skin or in the musculoskeletal system, but its main effect can be in the neurological system, because you have to realize that when you consume these substances, they get into the bloodstream, they go everywhere, and wherever you're weak, that's where it's going to hit you. So a lot of people say, well, I've read that milk causes psychoses, but it certainly doesn't cause psoriasis. Yes, it does in certain cases. It causes elevated systemic inflammation, which then causes your body to break down somewhere. It could be a pimple. There's another weird thing I've seen in my practice. I call it the phenomenon of changing symptoms. I've had patients come in who, let's say, have migraines caused by dairy foods, chocolate, and MSG, which is the trifecta for most migraines, those three substances. So we take them off of those things and they get better, their headaches go away. Months or years later, they come back and say, wow, I have this severe knee pain. And they're back eating the same things again. And they say, but I'm not getting the migraines anymore, so it can't be the milk. Yes, it's the milk again. There's a thing called the phenomenon of changing symptoms, which is one system will heal up when you avoid the allergen or toxin, and then you stay off of it for a while, your body gets strong. Then when you consume it again, your body will break down someplace else. And so you'll think, well, milk can't be knee pain and migraines. Yes, it can be one or the other, or both, or many other things, because all we're doing is we're filling the body up with inflammation, and it's going to bust somewhere. So that's the whole theory.
Very interesting concept. Now hit me with that. You went quickly over it. I had milk and I got MSG. What was the third one? The second one?
Chocolate.
Chocolate. Doggone. That's a very interesting point, because it just is. I mean,
well, here, everything I want to tell your listeners, everything I'm telling you today is based on observations. It's not theory. I can tell you have a yellow tie on. That's not a theory. That's an observation. Here's an observation. I found out that most people who suffer with chronic conditions like fibromyalgia, chronic back pain, whatever it is, most of them react to milk protein with inflammation of those symptoms. Here's another observation. Every single patient who reacts to milk protein with some kind of inflammatory disease, all of them also react to chocolate, only their reaction is worse. So there's some connection. I don't know what it is, because many forms of chocolate have no milk or milk protein in them. However, these patients will react only more severely. So chocolate is the one that a lot of people are bummed out. I've seen a lot of people who are vegetarians. They try to eat really well, but they do chocolate. And that's one of the reasons why they're hurting.
So glad you brought that up. It's just great information. Well, tell us a little bit, just to get back in the personal part, because your information is so provocative, and to coin a word we've used already in another context, but it's just great information. What happened that got you? Was it that one gentleman that went on that diet back in '92 with the milk diet? How did you actually, quote unquote, discover that? How did it reach your awareness when you?
Well, he was the trigger, and what happened is, at first when he told me this story, I thought, well, I got to go research this. Now, every other doctor he told, they said, you're full of it. This can't happen. Diet has nothing to do with your health. I didn't do that. I was young, and I said, well, I'm going to check it out. So I couldn't find anything. In all the research, I found nothing. So then in desperation, I had a patient who she wasn't responding to what I was doing. And so she was frustrated. I was frustrated. And she said, don't you know anything else you can possibly do for me? Because I've seen every doctor known to man. And I just said out of the blue, he popped into my head. This was a year after I'd seen this guy. And I said, do you drink any milk? And she said, I drink a lot of milk. Why? And I said, well, let me tell you a story. So I told her the story of this patient. I didn't believe it myself, but we did it with this patient. And guess what? Within 10 days, her chronic back pain was gone. To prove the deal, which is the provocative testing, I released her after a month. She came back 3 months later, being carried into the office by her boyfriend because she had severe lower back pain. I asked her about her diet. She said, no, I stay away from dairy foods. But this episode came on right after the night she had pizza. And she had been trying to avoid dairy foods, but she ate pizza loaded with cheese, and sure enough, her back reacted. I was able to see her 2 or 3 more times over the next few years, every single time a reaction after consuming dairy food. So again, it lit up my brain. I took a year off after I wrote my first book. I traveled the country going to chiropractors' offices saying, here's this book, you got to read it, you can help a lot of patients. The 2 responses I got are, they said, oh, I tried that, it didn't work, number one. The second one is, well, what if my patients all get better? What am I going to do then? I actually heard that from several doctors. So anyways, it's, it takes some persistence because, a lot of doctors will say, well, you know what, you might try cutting back on dairy foods. And then the patient says, yeah, I did that for a few days. I don't feel any better. Okay, that doesn't work. Let's talk about drugs. Let's talk about acupuncture. Let's talk about all these other things. So it's hard to do. It's hard to practice that way. It's very time consuming. I can't just come into a room, talk to a patient, examine them, crack them up. I have to go over everything that they consume and find out what's connected. That's the service I offer.
I'm telling you, it's a fantastic group of information and pieces of information. We're going to have all the books listed on your show notes, Dan, for sure. No question about it. And you're going to do 3 books that are with the chronic pain gone 90 days. You're going to do the giveaway, and it's going to be through a drawing, corebrainjournal.com/048, which is 048 drawing. I have to finish that. 048 drawing, which is Dan's episode. This is going to be so useful. I'm going to use it all on a regular basis because you, in just a short period of time, have put a lot of information together in a useful protocol, because I just don't have time to make it all, here's what you need to do next, here's what you need to do next. I just have to have them read the book and get on it, because we see this all the time.
Yeah, it's a how-to book. Like I said, for example, when people who have mental illness and they go to a doctor, I ask them, did they give you any tools? Did they tell you what you can do, how you can act? And it's generally no. It's they told me that your mother didn't do things right when you were young and this and that. But it's like, what can I do today? Throwing all that away, what can I do today to get better starting right now? And that's what my program is all about. The only problem with my program is that it does take time. Usually you'll see changes within 30 days. You'll see big changes within 90 days. And beyond that, you'll see even more. What amazes me is many people who came in for migraines, they see so many other things change that they're even happier about. Not only getting rid of migraines, but getting rid of that rough skin or that psoriasis or that digestive upset or those sinus congestions, whatever it is.
So, Dan, in closing, let me ask you this question, which is a practical question, a utilitarian question for some of the professionals or some of the clients who are out there thinking about how do you actually follow up with somebody after you've made that initial. Do you have groups? How do you actually, do you run virtual groups? How do you do consults? What do you actually do in your practice?
Well, in my practice, I just consult with people and have them come back whenever I think they need to be treated and managed. One of the most useful tools that all of your listeners can start using today is a diet diary. And that is every single day in your journal, you put down what you ate and how you feel. And you know what will happen? You will be smarter than I am about your case because you'll be able to see things. You'll be able to see what's connected. The problem right now is that people don't know that's where you look. If they wake up with neck pain, they think physically they slept wrong. They did something the other day. They had an auto accident 10 years ago. They look for the physical stressors when in fact it's usually chemical. So once you start compiling this list of what you're consuming, and then if you start pointedly trying to eliminate specific things and do it for the right period of time, you could start controlling your whole condition. And when we talk about your bailiwick, which is the brain, the main thing I've seen affected when you eliminate these specific pro-inflammatory allergens or toxins is it changes your mental state, your perception of reality. Imagine the perception of reality you have when you're in a bar drinking. That's why they have bouncers there, because it's affected by that neurotoxin. If you're totally pure, your perception of reality is going to change for the better. So it's all connected. It's all important.
That is such a great point. Now, in closing, you've stimulated me to ask one other question because it does come up. And my position has always been that goat milk and goat milk, goat cheese, and sheep cheese, all those are okay. It's a different casein. What's your take on that? Because you're the casein expert.
Right. No, those substances do contain casein, but what I do is try to throw away the scientific bent on it and look instead at the logic. The world was created, the animals were created, many of them are mammals. Those mammals, goats, sheep, cows, apes, humans, dogs, cats, mice, they produce milk for their young. All of their milk is different. It's different because mouse milk is not the perfect substance for a whale or for an ape. Neither is cow milk for a human. Neither is goat milk. So what I say is look at the big picture and think, listen, we're not supposed to consume the milk of another animal. So that's the main thing. Certainly the casein in these goat products is weaker. There's less of it. And so a lot of kids who have like recurrent ear infections, which is the classic milk allergy in kids, they get them on goat's milk, those ear infections will go away. But they shouldn't be doing the goat's milk either. If you want to do milk, do a plant-based milk like almond or soy or rice.
Thank you so much. Excellent point. That's that great piece of advice. Well, in closing, Dan, then let's get your website and talk a little bit about that, so we can hopefully send some people your way, because this has been. We really feel a lot of gratitude about you coming on and being here to really help us take it to the next step. So, where can we connect with you?
My webpage is called DanielTwogood.com. My last name is spelled like the number 2 and good, Twogood. I'll answer all emails. My email is drtwogood@aol.com. That's drtwogood@aol.com. My books are all over the internet. You can go to Amazon. You can download it. The cheapest way to get it is if you have a not an iPhone but the other kind. If you go to the Google App Store, you can get it for 99 cents. Pictures and everything right there on your phone. You can also get it on iPhones, iBooks, Kindle, Nook. It's everywhere. So my best advice, not just to sell books, but if you read the book, you will get the concept, and you will have it there at your hands, and you can refer to it. And you know the books that I think are important, I have on my cell phone, and I refer to them all the time, because you got to go back, you got to pound it into your brain. So the information is out there. Like I said, the best thing your listeners can start doing is start compiling a diet diary. Know the things about casein, MSG, aspartame, gluten. By the way, I didn't mention that the worst pills on the planet are cholesterol pills. They're prescribing them like they're a miracle pill. I see many patients come into my office, their symptoms like sciatica, foot cramps, leg cramps, aches all over the body are due to those pills.
You're talking about the
drugs. Right. So there's a plethora of information in the book. What it'll do is make you look in a different direction. The analogy I use is conventional medicine and looking for the solution to chronic pain. They're looking for the needle in the haystack. You know why they can't find it? The needle isn't in the haystack. They're looking in the wrong place. They never, ever ask you, what are you consuming and allowing into your bloodstream? If they did that on a daily basis, they would get to where I am right now, and they'd get way beyond it too. There's a lot of people smarter than me that would figure this stuff out.
Well, Dan, we need to have you come back and talk about cholesterol. That's a whole nother thing. That's probably, doesn't sound like it's your particular focus, but it sounds like you're on it. So that's another thing.
No, I've studied it a lot, and I can explain it so people understand it better.
We'll have you back and talk about that.
All right.
I love how fresh you are and how straight you are with the whole conversation. Very useful. Thank you so much.
You're welcome.
You have a good one, Dan. Thanks for listening to Core Brain Journal. We're working every day behind the scenes to bring you reports that connect research benches with those street trenches. Here we share the complexity of mind science because, as you know, details really do matter. One of the most pervasive, misunderstood challenges is how commonplace medications, like those written for ADHD, are used so regularly without clear guidelines. If you think you'd like more specifics, take a minute to download my 2-page PDF packed with video links and references on the absolute essentials of how to start ADHD medications. They're easily available at corebrainjournal.com/start. Thanks for listening. Do connect and stay tuned. Together we can make a difference.